The following webinar was recorded as part of the original implementation of IWISH and has been made available for informational purposes only. Some portions of the original recording have been cut to ensure participants' privacy. References to the Lewin Group, implementation team, site liaisons, PHL, Google Drive, and some forms are not applicable to the demonstration extension effective October 1st, 2020. Terms and conditions of grantee's cooperative agreement supersede any information presented here. Please see the IWISH Operations Manual for the most up-to-date implementation information.
All right, hi everyone. Welcome to the IWISH Checkpoint Team-Based Care webinar. Today we'll be discussing the value of team-based care in extending the capacity of your IWISH team and helping you to support your residents. We'll also explore how to think about and build upon your existing relationships to form cross-agency partnerships and work with hospitals and nursing homes. All right, so today's speakers and facilitators are pictured on the screen. Today we're going to be hearing from the IWISH implementation team as well as some of your peers and their experiences with partnerships. Again, the objectives today are just to refresh everyone on the value of team-based care, explain how to build on these relationships to form partnerships, or if you do already have partnerships, to strengthen these, and then hear from your peers and describing best practices for partnerships and communication. And with that, I will turn the presentation over to go over the value of IWISH partnerships.
Thanks, Emily. It's Nancy here. It's great to talk to you all. So today, as Emily said, we're really going to talk about the many ways that IWISH is a team sport, which I know you have all experienced. And so first, we're going to refresh on the value of team-based care so that, with the goal that you can use all the resources available to you to identify solutions to the challenges that that you all face in helping your participants in IWISH. Thinking about this webinar, I've been thinking about sports teams that my kids have been on. I'm sure many of you have been on sports teams yourself or have family on sports teams, and the first thing that really struck me is how each team has its own personality or culture, and that when you join a team, when the kid joins the track and field team, they have to learn that culture. They have to learn the culture that is, and they often get to shape the culture of the team. And that's really applicable to IWISH, that you all are shifting the way you work and creating a new environment, a new kind of thinking, a new kind of culture. So I want to start from the inside out and say, it's most important that you know what your role is. What is your role on the team? And for the innermost team in IWISH, that's all of you, resident wellness instructors and wellness nurses. But then as the core team expands, you're wanting to be sure that the whole internal team has your back. Your property managers, your maintenance techs, the owners of your properties, supervisors, including the wellness nurse contracting supervisor. The test as to whether you've achieved that team spirit is, are they making your job easier? Do they have your back? That's the sign of a really strong team. Second, as Emily mentioned, we're going to talk about starting where you're at. So the site liaisons are seeing that that's probably the most important strategy for you, is to start where you're at when you're building external teams like the cross-agency partnership, and looking at all the daily interactions you have with people externally, with organizations externally. And third, we want to talk about best practices in communicating with hospitals and nursing homes or rehab facilities, with the common goal that all admissions and all discharges work best for your participants in IWISH. So, Emma, if you can move me to the next slide, the Partnership Expands Team Capacity slide. So one thing we wanted to share with you, and many of you observed this, is that the healthcare world across the United States is really moving away from this long-held idea that one person or organization has all the answers to your medical or health issues, and that one doctor or a particular social service agency may have all the answers for you. If you look at that quote from Hennepin County in the slide, that county is particularly well known for being on the forefront of care delivery and has long recognized that teams are essential to good complex care. So they say, in complex care, no one entity believes they are the single solution. Working together is the solution. And that kind of, I think, says it all for your work and the IWISH philosophy that this is a team sport. And, we're seeing national data that's showing that complex care models with a cross-agency team are the most effective. And that's why we think it's so critical in the IWISH model to incorporate a complex care team thought, and that we recognize the teams are, there's layers and layers of teams. It's not just that you start with building teams externally, but it starts building really strong internal teams. And that, as I said earlier, that includes everyone within your organization on site, from the person who may man the front desk to the board of directors of your organization, that you're together going through this culture change and working together to figure out how that's going to shape your organization. And then, of course, residents are teaming with staff in the IWISH model, and with the resident always in the driver's seat, in the middle of the circle, defining what they need, learning from you as health coaches, and then figuring out how they want to age in place. And then residents teaming actually together on their own. I saw a really cool example where a property had a medical student meeting with residents. He came up with this really neat, it was a discussion group where residents would come around and reflect on back in the day during World War II and, what were their lives like, just remembering those times. And when the medical student's rotation was over and he left, the residents decided to keep that conversation group going because it was of such great value to them. So part of the teaming is residents on their own getting together, maybe carrying on a program that you started with IWISH, but they can take over themselves and manage it. We're certainly seeing that at a number of sites. And then, of course, next is then once you have the really strong internal team from residents to staff, then getting together and thinking about strategically together who your external partners should be, and giving that a lot of really careful thought. So, Emily, moving on to the IWISH partnerships slide. So, again, with the theme of starting where you're at, you've got a lot of ammunition, a lot of knowledge. First thing is you know your participants' needs. And so as you're thinking about forming partnerships, letting your knowledge and smarts about what your residents want and need, let that guide you in terms of who you partner with. And then knowing what you need. One of the most important parts of partnerships and teams in IWISH is that you can't do it all. You are all working extremely hard, but you need support yourself. You need to ease your workloads. You need to free up some time to do other things. And so thinking about what are those things and what individuals or organizations can help you with that. Who can help you with avoiding unnecessary visits to the ER? And that really, of course, requires really thinking about, so what's the root cause of an admission to the hospital? Or what is the root cause of a stay at a nursing home that's longer than it should be from a clinical need perspective? Why is that happening? And who can you partner with to reduce that utilization? And then just realizing that because this whole country is moving from a volume-based reimbursement system to a value-based reimbursement system, there's been no time where the healthcare world and the housing world has shared more in terms of shared goals. And healthcare providers, I know, are seeing that you can help them meet their goals of value-based care because you're the one that can help them get through a safe discharge back to home. So we're going to quickly flip through the 4 types of partnerships. Emily, starting with, as a refresher, the IWISH has 4 types of external teams, and some of them are more familiar to you than others. I know when you started this, you guys are really familiar with resource and referral partners, and you're the experts in that. You've been doing that for years, partnering, getting resources into your communities and referring residents to appropriate services. We know that facility partnerships have been a challenge, and we understand that's because in almost every site, you have a relatively small number of admissions, residents admitted to facilities, relative to the number of patients at a hospital or the number of residents in a nursing home. So we get that. And so many of you are starting where you're at. You're building on the one-to-one relationships at a hospital with a particular discharge planner or multiple discharge planners, but you're building a partnership. It's not yet with the full organization, but it is with the individuals that work there, and that is of great value. And the cross-agency teams, I'd say that's probably the most important partnering. But we're seeing that they're getting built and operated really differently from site to site, and Stephanie's going to talk about that. And then moving on to the next slide. The other partnership is with primary care practices, and from the beginning, that's the one where we know these relationships get stronger based on the evidence. So you're not going to have a partnership with a physician practice immediately until you get to know each other, and most importantly, when a physician sees that her patient is controlling their blood pressure or is exercising more, and it's because of your hard work, that's when the meaningful partnership forms. And last, of course, again, the resource and referral partnerships are the ones that you guys ace. And if you pull up the next slide, on number 12, you are incredibly successful at that, and just keep up the great work. And here's the proof. So slide 13, IWISH resources through collaboration. This shows you the top resources that you have provided to your participants across the 40 sites, and that's a lot of resources. So you're really excellent in that, and thank you for that work. So I'm going to turn it over to Stephanie to talk a little bit more about team-based care.
Great. Thank you, Nancy. And I think that was a great overview and kind of introduction to the landscape of what's happening, not just from a housing and IWISH perspective, but also in healthcare. And I want to talk a little bit more about how we fit into that landscape. And I'm glad that that Nancy went back to the background of IWISH in those multi-layers of teams. And I won't spend too much time on that because we've hit it before in all of our trainings with all of you, but just that for all of you to remember that the foundations have to be in place for the strengths to go there. The staff as a team, meaning both the RWD and wellness nurse team, or if that's 2 of you, 4 of you, 6 of you, whatever that is, that's really foundational. And then that close working relationship that you have with your property staff, property management, maintenance, ownership, and whoever that is. So that's the strong foundation you start from. And I think all of you are really good at that. You're building that. Some of you have had turnover, so you're rebuilding it, doing new launches, and that's terrific. And there's always opportunity to revisit, because what we understand is that it takes a while for these external partnerships to happen, and now is a really good time to be visiting them and approaching them really again or new, depending where it's at. And we'll look at that from different perspectives, because you do have some of that evidence and that baseline to go from. First of all, most of you are much more comfortable in the IWISH model. You've learned it, you know what it is, and you're seeing the impact. You're going to be able to have a stronger outreach. And second of all, your partners that you work with are going to be there. So now is a good time halfway through the demonstration to do that outreach. So I want to talk to you a little bit more about what's happening in healthcare that you may or may not be aware of, but just so you know that as we're pushing all of you a little bit out of your comfort zone, and my sites, sorry, know this better than everyone, that I'm always kind of pushing you a little bit more to say, who can you talk to? Where does this go? That healthcare is being pushed in the same way because just the world is changing. So I'm going to go ahead and go to the next slide. And what it is this team-based care approach that we're looking at how we're delivering both services within housing and bringing in a nurse to housing in the IWISH model. This is all very new, and it's tricky at first. It's different. It's new. We have to explore, what does this mean from a fair housing perspective? What does it mean to have a nurse on site? What does it mean for HIPAA? So it's been new for all of us, and we've needed that past year and a half to really get used to it. And we're only a small fraction of all the housing sites in our city or region or the country that are exploring this. And so in that same way, healthcare is being pushed, like Nancy said. Healthcare has very historically and traditionally been a hierarchical model, that it works from a top-down perspective of kind of, people stay within their role. And at certain times that's good, but it really is, there's so much coming out now and today saying we're moving healthcare to a team-based approach, especially with the complexity of people that we're seeing, and also with the way payment is changing. So we need to move to team-based care. And the quote you see on the slide in front of you is from an excerpt teaching primary care providers how to move to a team-based care model. And primary care is making this transition, I would say, much more easily than hospital. For those of you who don't know, my background has always been in social services and housing in that area, but then most recently I worked within a hospital network, a large hospital network for Vermont. No one laugh out loud here. No, I'm just kidding. But And so it's really looking at, and then working across the country and looking at how hospital and health networks are shifting to this team-based care model. And it can be challenging. So this quote is really saying that team-based care, there's evidence to say it has the potential to improve the comprehensiveness, coordination, and efficiency. We're going to talk a lot about efficiency today and effectiveness of care, and of course the satisfaction of patients. And a lot of this really has to do, until our payment models fully change, we have to look at who has the time to really dig in and talk to people about those important things to them. What's important to you, like we always talk about in IWISH, and how do you want to achieve that, and how can we get there? What are those social determinant things? What's going on with your food and your housing and all those important factors? And right now, certain parts of healthcare are getting paid more for the quality and the outcomes they delivered, but a lot of it is still getting paid by each service and each person they see. And in that sense, you hear about those 15-minute doctor visits. And so, the best physicians in the world would love to sit down and spend an hour with their patients and really talk to them about everything going on in their life, but they just can't. They have to see a certain number of people in a day. So they're shifting to this team role, and then they have to really communicate well with everyone on their care team to say, okay, who knows what's going on in the home with this person? I know what's going on with their diabetes. I know what happened with this test result. Who can address this so that they feel more comfortable taking their medicine? And that everyone has to play an important part of that role, and everyone has to communicate well. And you all are so critical in that role, because you often have the key missing pieces of the puzzle to help with that person the best that they can. And when I was working in healthcare, it's really hard to get them to shift from saying patient to person, but really they're not a patient. This is a human being that has lots of things going on. Okay, we can go to the next slide. So I just want you to know that at the same time that you are really shifting how you're changing the way you deliver services in your housing sites, the healthcare all across the country is shifting in the way care is delivered, and it's tricky. So we're all kind of learning and growing together, and change is never easy, but I have this great quote that I hang on my office wall. It says, change is hard in the beginning, messy in the middle, and beautiful at the end. So we might be a little bit in the messy part, and that's okay, but you know how much humans love to change. So some of the advantages of team-based care, and this is again taken from a medical perspective, and it's not that you all are the medical model, but you are a key component to helping them with success. And when I say helping them, helping the healthcare system, and ultimately the human beings who take part in the healthcare system is all of us. And this comes from the Institute for Health Improvement. But the advantages are enhanced access to care and services with a consistent care team. This is the best way that things are delivered. And consistency is going to be really key to what we talk about today. So I'll come back to that. So just remember, consistency is really important, and consistency is key to communication. The improved quality, safety, and reliability of care, that also comes out of a consistent team. So reliability, consistency, enhanced health and functioning of those who have a chronic condition. So, I've seen a lot of your community profiles. You guys have all seen your community profiles. I would say maybe 1% of everyone in your buildings has 0 to 1 chronic condition. So, you're all working with vulnerable populations. So you have that advantage. If you work in a good team environment, it can help those people that we serve. And this is more cost-effective care when you work in a team. And that is absolutely true, which is the purpose of the IWISH demonstration, and we know. And not only cost-effective, but just more effective care overall for everyone involved. So not just the staff, both the IWISH staff, the RWDs and the wellness nurses, but it's more effective and cost-effective for doctors, nurses, case managers, whether that's, or people agencies on aging or Medicaid case managers, people who do billable services. It ends up being more cost-effective for them in the long run, even though initially they might say to you, why would I come to a meeting? How am I going to go to a meeting that's not a billable hour? But we want to be that's kind of pushing those boundaries and thinking longer term. And then, of course, it's an improved experience for the people we serve and their family because we're all communicating with each other more efficiently, consistently. Okay, next slide. Okay, and this is a little bit more about what we do that makes an effective care team, that we do things more effectively when we work together. And this is some of that kind of messy in the middle stuff that I was talking about when this has changed, that if you're an effective care team, you learn from the regular practice to fine-tune your skills. So it's not going to be perfect the first time you come together. You're going to have to constantly be tweaking it. You're going to have some shared goals. What can we all get out of this? Why are we coming together? You know, the what's in it for us. But you're going to find how you have that when you bring your partners together. An effective care team also learns new approaches to care delivery. And this is any kind of care, but really it's person-centered care. What do those people in our communities need? And they're all complex. So we want to talk about that with the people we work with. And then having clear roles and responsibilities. So you know that with our kind of I-HAP goals with our residents, we want them to have SMART goals. They can't just say, I'd like to lose weight. You want to know, how much weight do you want to lose by when and how? Do you want to walk 3 times a week? And, do you want to walk back and forth to the mailbox 3 times a week for the next 4 weeks? Something like that. Same thing for your team. Make sure no one walks out of a meeting, a conversation, a phone call without knowing who's doing what, because that's going to show the value of it. So we're going to know that instead of 3 different people possibly working on a SNAP application, or 2 different people reaching out, for the, medication reconciliation. I can't think off the top of my head. You're going to know one person's going to do this, someone else will follow up on that, because I guarantee you there's some duplication happening. We just don't know about it. And then through this process, you will learn to rely and trust each other. And you may just not know each other. And as you go through this process, you're just going to get more and more effective communication, and I always say more efficient communication. Because I know you're all talking to your partners already. You've all told me that, at least at my site. But they're very much one-off calls, talking about a particular individual residence. But eventually you will get to a process where you can streamline that communication, and it's just as effective, if not more, and it's efficient for everyone's time. So it can really work. It's just going to take a while to figure out how to best do that. Okay, next slide. Okay, it's really hard when we're not doing our own slides. I know I'm a little bit over time, but we built in extra. And then just the best practice, I just wanted to show this with you. This is from a 2018 National Academy of Medicine report that was in the Blueprint for Complex Care that was looking at not just medical teams, but it's really looking at the National Center for Complex Health and Social Needs, which really looks at how do we help our most complex people in the country on their health and social needs from all perspectives. And they're looking at what are the common features of effective care coordination. And I just wanted to emphasize how much you all are already doing from the perspective of what they're also teaching in healthcare about the best practices for effective care coordination or service coordination, that you've got RNs and you've got your RWDs, and you are really already doing so much of this that you are an asset to all these other providers out there. So you've got teamwork already, and you can add your teamwork to what they're building or might already be built. You've got coordination of services, and you can add on. You're responsive. Again, you're going to build this communication. You're not doing medication management, but because you're doing some reconciliation, you know what medications are in the home, the RNs do, they're the wellness nurses. You are such an asset to these primary care doctors, emergency rooms, hospitals, that they know, once they know what you have, they can call you to figure out what's accurate and what's not, because that leads to so many errors. You are the extension of care to community, the outreach part. You are the solution that they may just not, they don't know about. That integration and the follow-up on transitions of care. So what the healthcare community may or may not know is just how valuable you are. And we don't have volume in each area, but you have a benefit that is very important to all of them. And the one thing I also want to add is that I'm often, when I'm doing work around the importance of housing and healthcare coming together, I talk about a very different lens of cultural competency. I think you all had training on cultural competency in the traditional sense of the word, but there's also a necessary use of it between healthcare and housing in that understanding what each of our industries means to each other, and that healthcare has a lot of terminology and frameworking and language that we may or may not know really well, and so does housing that healthcare doesn't know. And when we have this consistent team set up or consistent communication, we start to learn each other's languages and billing structures and limitations and opportunities, and are basically those cultural competencies where we see the opportunities to better streamline care. And I think that's really the value in creating this cross-agency care team, that we don't have to do it the way it's always been done, and it's not necessarily going to be easy. So I just want to kind of open your minds to thinking about this in a new way and see where we can go from here. And then Nancy and I are going to help you explore, like, okay, I see what you're saying, but it sounds hard, or I don't know if it'll work in my area. So we want to kind of walk you through how do we take those first steps into building this care team. And I'll stop there. That's my last slide.
Thanks, Stephanie.
Sure.
Great. So then let's dig in a little deeper into identifying the members on your cross-agency team. I thought it was really wonderful when you did the poll this earlier that I think every one of you, except a couple, actually know who the case managers are that are coming into your building. And I'm sure you know which agencies are doing the best job with your residents. So there you go. You know them. You know the agencies. You know who does better than others. So talk to that case manager. That person is probably perhaps not the one that might join your team, but they will know who to talk to at their agency about how to work together. And when you do meet with that agency, after careful vetting, careful thinking about who you want, because you cannot uninvite people to the team. Once you invite them to the dance, they're going. So you need to be perfectly sure that's who you want. And when you meet with that organization, don't just talk about the challenges among your residents. Talk about how successful you've been, how you have helped individual residents, no names, but just sharing the general accomplishments that you've had. And back to, the larger team concept, that the measure of a good team is feeling like you have each other's back. You want to be able to explain to them that you're going to be helpful to them. It's not a one-way street, but you are able to, take a call from a mental health worker who can't get to see their client, and one of you can, check in on that person and, help ease each other's workloads so it's mutually beneficial. And as you move on with the relationship building, make it easy for them. Make sure they know how to reach you. Make sure that you're able to communicate regularly. And moving on to the next slide, the build from where you are slide. We're really aware that many of you, as you look at this ring of cross-agency team members, might be a home health rep, might be an area agency on aging rep, might be someone from a mental health agency. The green box is there's probably going to be an agency that is unique to your site and your residents' needs, and you've identified them as being particularly important to join your team. It might be a Medicaid case manager. Keep in mind that the team is small. This is 3 people maybe that are meeting with the RWD and wellness nurse on a regular basis through some means, many different ways to meet. So it's small, it's intended to be small, it's intended to be the exact same people every meeting so that you're building trust together and you're building a knowledge bank that doesn't have to start over every meeting because you got somebody new coming over from the home health agency. The other thing I wanted to clarify, because I think sometimes people think, well, I really should look at a home health agency that has the most clients in my building, and that's the one I should invite to the team, even though there may be 10 home health agencies that are coming to your property. So I would look at it very differently than that, because in my experience, home health agencies, they're sending different nurses all the time. There's often no consistency. That's difficult for them to manage it and send the same nurse to the site. So, and the staff turnover. And so what you're looking for is the home health agency that you have evaluated has the greatest expertise, the real strength in the areas that you need help with. It's fine if you select an agency and a person from that agency that you feel just has the broad expertise that you're looking for. That's fine. Like, don't feel like you need to be aligning who your residents see by an agency and who you ask to join, because your needs are going to change, their needs are going to change. What the consistency is definitely keeps emphasizing is the consistency of the person that's coming to the team table and problem solving with you, on a regular basis. Next slide, Emily. Strategies for engaging partners. Again, you're wanting to be prepared with the information about your site, and I've covered this, so we can move on to the next slide. Communicating with partners. So,
Nancy, can I jump in for a second?
Sure, please.
Oh, I just want to say on that last side, we're going to get to this later, but we are preparing some tools for you that we'll send out because we know it's been a while since it started, and we're making some brief tools. So when you do go out to communicate with people or you do that first email introduction, the IWISH implementation team, we're making you some new, very brief tools so that to make that a little bit easier for you. We're trying to make your job as easy as possible in that sense. So we're going to give you some new tools for that, strategies for communicating and helping out with that. I just wanted to add that. We'll get to it at the end, but I thought it might be more pertinent to just to let you know. We'll hopefully give you a gift in the coming few days. That's it.
Cool. Thanks, Stephanie. That's awesome. Excellent. So now you have your partners and you're starting to meet regularly. And I know many of you are concerned about, people can't get to your property or, this is where creativity and flexibility come in, figuring out when your partners meet. I remember one AAA agency, they assigned their clients to their case managers alphabetically. So like one case manager had A to G, and of course your building has the whole alphabet soup. And so, one approach is, well, there's multiple case managers coming into the building for a variety of reasons. So maybe, you can come to them. So they have a regular case meeting and you ask, can you bundle the stash clients at the beginning of the meeting or the end of the meeting, and you'll join them by phone or in person to talk about your shared caseload. But again, more importantly, to talk about but general challenges that you're facing that the case managers have knowledge about, and not because your resident is their client, but because of their long time experience. Having a regular agenda, the RWD would be putting that agenda together, and again, just being as concrete as you can about the kinds of things you want to talk about, the kinds of things you want them to come prepared to advise you on. And then moving on to the next slide. So as I said, we hear you that meeting with partners is a challenge. Many are living in very large urban areas where it's hard to get from A to Z in a reasonable time. So, you know, there's Zoom, there's Skype, there's many different ways to meet. The point here is that you want to be sure you're building a tight team, that you know each other. Maybe you start meeting in person for the first couple meetings, and once you get a sense of each other, you know, it's okay to have a meeting by phone, or it's okay to, you know, go over to their place and have the other team members meet you there. You know, don't feel like you got to be in your conference room every single month, and that's locked in, because we know that's not reality. But again, just think about the goals of partnering, which is being on a team, having mutual support, helping them as they help you. You know, it's a phenomenal thing when a care team really operates at its highest value. So I'm going to turn it back to Stephanie.
And so just on the flexibility piece, is just really thinking, you know, we know there are barriers. People are busy. What do we do about people who can only see someone if it's a billable service? What about HIPAA? HIPAA, I do want to say that you guys people have signed their releases to talk to other organizations, and under the HIPAA for healthcare operations and care coordination, you can talk to other providers, you can talk to other entities for the best interest of the person you're serving, and, you know, think about location. Do you want it to be remote? Do you want to meet where they're at? Are people already coming together? So really think about all those things and think about solutions. But we can always find barriers to things, but we really want to think creatively about different solutions and how we can do that. Next slide. I think, Emily, am I turning it over to you here to talk about what's next?
Yep. All right. So as Stephanie mentioned, we are going to get you guys some of those resources to help you in these next steps. That will hopefully connect you to potential partners. And then you may also use the worksheets that are in the partnership guidance. And it'll help you prepare your elevator pitch, which will be included in the forthcoming materials.
So the care transitions, or facilities, is what it's called in the guide. And with transitions of care, we're going to emphasize the same thing again. And here I have this nice quote: to start where you are, use what you have, and do what you can. So don't. What I'm going to say here is don't get overwhelmed by what you might think you're supposed to do, or any big agreements or anything like that. It does say in the operations manual that ultimately you want to have written agreements with certain partners, like skilled nursing facilities and hospitals and all of that. And I think people might be letting that scare them a little bit. It seems too big and too hard. So use what you have and do what you can. That's okay with us. Okay, you can go to the next slide. So in this case, so the partnerships that we call facility partnerships or facility collaborations, you know, Pam mentioned this, and, you know, she's near Detroit. All of you are a little bit different with how many hospitals, skilled nursing facilities, what do you have nearby you? What are your relationships? All of you are a little bit different, although I will say, in talking to my 15 sites, you're all similar in that You're never getting the same discharge planner or case manager, social worker when someone goes into the hospital. It's always different. And what's tough about that is you cannot build that consistency of relationship that we talked about in the beginning. And that's really tough because they don't start to know who you are and what IWISH is and what you're doing in the building. So that can be really tough. So we're asking you to kind of flip those tables, knowing what you now know about the changes going on in healthcare and how they're really moving to a team-based model all across the country. So when you go talk to them, you want to really think about what facilities your residents visit the most. I think you all probably know. You can talk off the top of your head and say, well, they have choice or they usually go here. But think about that. Maybe it's 3 hospitals, maybe it's 1, but it's generally not 10. And then you want to figure out who to talk to at that organization. And I think that if you brainstorm, you'll come up with the right person. And it might be the director of case management or the supervisor of discharge planning. Someone like that, and a lot of you reached out in the very beginning to that person to talk about IWISH, and that's great. It's probably time for a refresher because they've had turnover in that time, and you all know so much more. So you can make it a more meaningful conversation and just say, hey, do you have half an hour? We'd love to come by and just give you an update on how IWISH is going since we started. And just talk about what would be better for them. How can you better partner to support the residents that you know sometimes go in and out of the ED, though hopefully a lot less. We can go to the next slide. So I think start just brainstorming about this, and don't worry right now about trying to have some sort of formal agreement with the CEO of a hospital, because that's not going to happen the first thing. That's not where we want to start. The things to kind of bring with you, or when you do that initial email, like I said, we'll be sending you some sample, what we call elevator pitches, some very short ways on how to collaborate beneficially, how to describe IWISH in a short and meaningful way that's meaningful to them. Think of a nice success story you can share, like the one Pam just shared with us, that has a lot of value to a facility like skilled nursing or to a hospital or primary care, because that's someone that they were probably really struggling with. And because Pam, knew her so well and could make those phone calls, and Dorinda made phone calls, that's great. Always be prepared to show a sample ROI so they understand what all your folks are signing. Another thing is, I know a lot of you have mentioned to me that you have really great relationships with your EMT providers. I'm impressed and shocked how many of you have a single EMT provider through the city or through someone else, and you're asking for an update on their statistics because they have to track their number of calls to certain addresses and locations. If you're able to show, look, we're having a decrease in calls to our site, that's a piece of data that you can show to them that might make a difference as well, if you're able to get that. I know some of you are working on that. Some of you may not have access to that. That's fine. That's a way around the fact that you may say, we don't have that many people go that often, but it still shows a change. Work with what you have. You may or may not have that. So we're just trying to give you some ideas of ways to reach out with your partners and think about who they are. And, consistently with social work, case management, discharge planning, there's a lot of different people, and depending what floor of the hospital they go into, which department, it's going to be someone different. So, don't feel nervous about going up a level and calling that manager or that supervisor of a department, because you are offering something that they really value. You're helping people transition home well from the hospital, skilled nursing facility, and you're helping them to not readmit, because whether it's a skilled nursing facility or a hospital, if they readmit again within 30 days, they get penalized. They get financial penalties. So you're their best friend if you can help prevent that. And they also care about people. But you really do have a lot of value for them. So I'd love to know that. Okay, next slide. I'm going back and forth because I have a little delay here. Oh, okay, this is me Google mapping again. You guys love my Google Maps? So I pretty much talked about this already, but it is just use the knowledge that you have in your area and think about who's best. Now, I've had some of you say, like, you may have several hospitals, but they might be owned by the same health system. So again, you may be going to talk to a director rather than a supervisor, but just think about what you know. And we definitely understand that, you know, Belleville may have fewer hospitals that still has 3 or 4 that everyone goes to, whereas if you're in the middle of Chicago, that's a lot of hospitals there, and people may have no consistency, and they may intentionally go to different hospitals each time. So you're dealing with a different landscape. And then in Atlantic City, New Jersey, you're in good shape. It looks like everyone's probably going to go to that one hospital that's right there, so you can really develop a strong relationship. Also at hospitals, there's probably a community integration person or a community health staff person that might be good. So be creative. And what we probably haven't said enough during this call is that you all know your local area better than anyone else, and your partners know their local area. You know the people who live there. A lot of you are from that area. So, you know, build on what works in that local area. So this is just to show you that, of course, everywhere is going to be different, and you know what it's like in your area. And just use your knowledge of the area and the regional facilities. You know, is it owned by a large system? Are there lots of competing large systems? Is it just one small hospital? But be creative. You guys know what it's like where you live. Okay, next slide. Some other things to consider. Are there already some existing collaboratives in your region? Can you become a part of that? Can you get a seat at the table? There are a lot of national initiatives around what are called accountable health communities. That's a national initiative. There's this is literally called the Share Network in Chicago. And then health systems are starting things. They might be started from a community perspective. See what's happening in your area. And if you're not already a part of it, let them know, hey, we're housing that now has a care model in it. We have an RN. Let them know that you want a seat at the table. Be available to join them. It might take a while, and just see what that might take. I think that's my last slide. I'll turn it back over to Emily.
All right, thanks, Stephanie, and thanks for that real-world story and perspective. That was nice to hear.